Hi, I'm the Director for Common Knowledge Trust, and we produce Birthing Better Childbirth Preparation online course. So today I want to talk to you about what the Birthing Better families taught me about birth skills and birth coaching skills. For those of you who haven't listened to any of the series, Birthing Better was developed by hundreds of families that I happen to work with. I'm not a birth professional. I happen to help fix bad backs. However, we stumbled across this understanding that we all shared a human body, both men and women, and that pregnancy and childbirth was actually this very universal experience that we had. And so skills got developed around us in our births, and they've been amazing. But everything I've learned from the families that I worked with, and why they chose skills, and what type of skills were important. And what we discovered was that, as you all know, each of us is an individual. Our birth will be individual, our pregnancy is individual, how we raise our children, everything about us is an individual. However, there's a process of being pregnant that we all share. No woman gets pregnant in her big toe, and no woman gives birth out the top of her head. And yes, there are surgical births now, but it's still giving birth. So Birthing Better families are always focused on the birth of their baby rather than the type of birth, or even who was at their birth, or where they birthed their baby. Certainly people wanted some to have their babies at home, and some in the hospital, and some with a midwife, and some with an obstetrician. But really what was important was our ability to birth our babies, rather than the type of birth, or where we birthed, or what even happened to us. So what we found was that skills were very eclectic, and there's a broad range of them. We first discovered that although it's great to have birth and birth coaching skills, you had to start before that and to actually prepare your pregnant body to become a birthing body. This doesn't take a long time, and it doesn't take a lot of effort, but you should really start as close to 24 weeks as possible. That's when your uterus is already up to your belly button and you're feeling your baby move, but you're also becoming aware that the birth is around the corner. In fact, it's 16 weeks away, or less, or a little bit more. So if you allow yourself 16 weeks, that means that you can be focused, you're feeling good, and you can take time to learn how to prepare your body. What we learned in the simplest way was that giving birth, no matter how we do it, is an exercise in plumbing. We have a big object growing inside us, and that big object has to come out. And our body is the container where this big object is. So it makes sense that we prepare this body to open up and to let this big object out. So we developed skills on how to open up the pelvis. The pelvis is, for most people, just out of sight, out of mind, even though we have it all the time. So there are specific ways to open up the pelvis side to side, and that's called the hip lift, or front to back, and that's called the sacral maneuver. And you can use those two together. You can't do them on your own. You have to have someone else help you. But when you feel how much space you can create, you realize how beneficial it is. And when you then create very slight internal tension, you realize how easy it is to stop that movement. So we also needed to work on how to help our cervix dilate if we were laboring. And so the skill that got developed was called the pelvic clock. And even more refined, we had a cervical relaxation that we could do, and those two we could do for ourselves. However, it was really helpful when our partner reminded us to do that. The other things that we had to think about was our breathing, and there were a lot of breathing techniques that were available, and sometimes they didn't work, and we had to understand why they didn't work. And the reason is that we actually didn't understand how humans breathed. We all breathe in 4 ways, and most of us aren't even aware of what those 4 ways are. And if you think about it for a minute, then you may say fast or slow, or in your belly or in your chest, but really you breathe in your nose and out your nose, in your nose and out your mouth, in your mouth and out your nose, and in and out your mouth. But each of those variations has variations within it. So if you make a list of when in your life you breathe in your nose and out your mouth, you'll realize that you do it when you're relaxing, when you're exercising, when you're having sex, when you're screaming, right? When you're moaning, right? When you slack jaw, relax. When you blow out, relax. So all humans use in the nose and out the mouth in a variation of ways. And so we had to learn about how to create the best breathing patterns and how for our partners to recognize when we're slipping away from them and to help us get them back by modeling good breathing patterns. So those few things are just part of the birthing better skills, and I'll talk about more on another time.